Thomas.
6 months ago, at the beginning of November, Alexandra Avenue Walk-in Centre in my constituency closed its doors for the last time. And if ever the story of a much-loved, vital service told the story of the crisis in NHS funding in northwest London, it is Alexandra Avenue. It opened 10 years ago, Sir Christopher, and at the time its opening was strongly opposed by the Harrow West Conservative Party and its then parliamentary candidate. She and Harrow West Conservatives didn't have an immediate success in getting it closed, but in 2013 it was closed during the weekdays, only kept open as a result of a local campaigning at weekends. But in November last year, they finally had their way, and a service that was at its height providing a valuable walk-in service from 8 a.m. to 8 p.m, 365 days a year, to 40,000 people in my constituency and surrounding constituencies, finally shut its door. And it shut its door bluntly because of the lack of funding of the Clinical Commissioning Group. Clinical Commissioning Group has been put into special measures as a result of having a £40 million forecast deficit. This is according to the Minister for Health back in February. Not surprisingly, it is under pressure to make a huge range of cuts. So not only at the moment is there no prospect of Alexandra Avenue Walk-in Centre being reopened, Sir Christopher, but other walk-in centres that serve Harrow are also vulnerable, apparently, to being closed at a moment's notice. Not surprisingly, this has had an impact on Northwick Park Hospital, which serves my constituency. It has not met the A&E 4-hour waiting target for some considerable time. On average, over the last 5 years, 25% of patients in A&E are not being seen within 4 hours. A further indication of the decline in quality across the National Health Service in North West London. So I am grateful to my honourable friend for Hammersmith for securing this debate and for allowing me to ask a number of questions of the Minister. When will North West London NHS be properly funded? When will the sorry tale of the Clinical Commissioning Group, always finding itself in deficit, not because it can't manage its books, it has excellent chairs and excellent board, and I pay tribute to the outgoing chair, Dr. Amal Kilshika, and the incoming chair, Dr. Genevieve Small, for their willingness to put the commitment in terms of the hours. They deserve to know that their Clinical Commissioning Group is going to be properly funded in the future. Similarly, when will Northwick Park Hospital not have to, each year, face a situation where it and the other hospitals in the Trust are not being properly funded, are having the support they need to get the consultants and nurses in place so that that A&E target can be met? My honourable friend for Hammersmith mentioned the closure of Central Middlesex, which has had a huge impact on services in North West London, including the services that my constituents depend on at Northwick Park Hospital. It, frankly, should be reopened. We need that acute capacity, and it would be good to hear whether the Minister can foresee such a scenario for happening. It is now clear that cancer waiting times are under pressure in our community as well. For the first time, the maximum 2-week wait for a first consultant appointment after an urgent GP referral is not being met, according to the latest data in our area. So Harrow's Clinical Commissioning Group needs to be properly funded. Funding for the NHS in North West London needs to be significantly increased. And in my view, there needs to be a dedicated national fund in England's National Health Service to pay for walk-in services to be provided across England where there is a strong evidence of demand from communities such as my own. And I look forward to having some positive reassurance from the Minister that the Conservative Party has changed its attitude to walk-in services such as at Alexander Avenue and Rones Lane.
And back.
Thank you. So, Chris, it was a pleasure to...